A very good morning, students. Today I am going to demonstrate you the kidneys, okay, right and left. As you know, kidney is a paired organ. It is present on right and left side, okay, in the posterior abdominal wall, okay. And in the posterior abdominal wall, it is at the level of the lumbar region, that is the upper end of the kidney, which is a bean-shaped structure, extend from the T12 thoracic vertebrae, that means 12 thoracic vertebrae, and its lower pole or lower end lies at the level of the L3, lumbar 3 vertebrae, okay, lumbar 3 vertebrae. Now this organ is partly behind the peritoneum, so retroperitoneal structure is there. As when I will teach you its relation, then you will realize that only partly it is covered by peritoneum on its anterior surface. The posterior surface is not covered by the peritoneum, okay. Now this structure, that means the kidney, okay, it is about 11 centimeter long, both right and left. They must have almost the same dimension. Now these two kidneys which I am showing you here, they are not from the same body, okay. I could not get the kidneys from the same bodies, okay, which were healthy. So I have chosen the kidneys, okay, from the two different bodies. This is the right kidney and this is the left kidney. But I will tell you about how to determine the side of these kidney, okay. So I was talking you about the measurement of the kidneys, okay. The measurement of the kidney is, it is length from the upper end to the lower end, it is around 11 to 12 centimeter, okay, 11 to 12 centimeter, while its width or its broadness, okay, from one border to the another, medial border to lateral, is around 6 centimeter. And if you see the thickness, okay, between anterior and posterior surface here, anterior and posterior, then it is around 3 centimeters. So very easy to remember that it is 12, 6 and 3, okay, 12 by 6 by 3 centimeters in the measurement. And almost a kidney weighs around 150 grams, okay, and slightly less in case of the female, okay. The female kidney is little lower. But when I was saying you that the kidney is extending from the T12 to the L3 vertebral levels, but the right kidney, okay, this is the right and this is right kidney, is at a lower level, little lower level as compared to that of the left kidney. Why it is so? Because the right kidney is displaced downward because of the presence of the livers. Because on the right side there is liver, so the kidney is little at a lower level as compared to that of the left kidney. Let us come to the external features of the kidney. Now if you see the right kidney or to the left kidney, it has two ends which are called as poles, an upper pole and a lower pole, okay. This is upper pole and the lower pole. Now let us see the difference between upper pole and the lower pole. Now in the upper pole you will see that upper pole is quite broad, okay, as compared to the lower pole which is narrow and blunt. See here in the left kidney also, okay, it is the broad and here it is narrow and the blunt. The upper pole of the kidney is in relation to the suprarenal gland on both sides, right side and left side. This is the right and left suprarenal glands. They are in relation to that of the upper pole, okay. Now if you see after seeing the poles or ends of the kidney, let us see the surfaces. Whatsoever surfaces I have kept here, it is the anterior surface of the kidney, okay, it is anterior surface. naturally then the other surface will be the posterior surface of the kidney. Now let us how to find out which is anterior surface and posterior surface. Remember that the anterior surface is slightly convex, okay? If you can see it in this direction, yes, you can see that the anterior surface is slightly convex, and if you will trace your finger onto the anterior surface, it is quite irregular. At certain places it shows depression, at other places there is a elevation, so it is quite an irregular, and the reason for this irregularity is that many other viscera they are lying onto the anterior surface of kidney. Either you take the right kidney or left kidney. You can see here this is the anterior surface of the left kidney, and it is quite convex anteriorly, and it is also irregular. It is bulging here but depressed here, again depression is seen here, a groove is seen here, like that. So these are the irregularities which are present onto the anterior surface. Okay. Now this anterior surface, as I said, is partly covered by peritoneum, not completely covered by the peritoneum. Okay, I will tell you which of the areas which are covered by the peritoneum. Right now there is no peritoneum. Whatsoever you are seeing, this glistening membrane, it is the capsule, okay, which cannot be stripped off. Okay, so this is here covered by the capsule, not by the peritoneum. So that you should understand. Okay, let us come to the posterior surface. So I was telling you how to distinguish between anterior and posterior. Just try to feel the two surfaces, anterior surface and the posterior surface, with the help of your fingers. Then immediately you will notice that this posterior surface is flat. It is not showing any irregularity as the convex anterior surface was showing. It is absolutely a flat surface because it lies onto the posterior abdominal wall, which is mostly made up of the muscles. Okay, it is made up, so it is flat. But here anterior surface was irregular and convex because I said that many abdominal viscera they lie onto the anterior surface. So how you will distinguish between anterior and posterior surface? Anterior surface is irregular, slightly convex, but posterior surface is flat. Okay, regular and flat surface. This is the way how you will find out the anterior. See in the left kidney also, this is the anterior surface, but when I will turn it to the posterior surface, you will see that this posterior surface is absolutely flat, right? So this is the two surfaces of the kidney, anterior and posterior, and I said that posterior surface is not covered by peritoneum, partly the only anterior surface is covered. Okay, now after seeing the poles or ends of the kidney, superior and inferior, or upper pole and lower pole, let us see and after seeing the surfaces, anterior and posterior surface, see the borders. Okay, there are two borders, medial and lateral. Now this border where the structures are coming out in the hilum or going out of the kidney, this is the hilum, okay, of the kidney, and this is the medial border. That means from where the border which gives attachment to the blood vessels, that is artery and vein, and then the ureter comes out, that is the area where the hilum of the kidney is present, and this hilum of the kidney is the medial border. It is located on the medial border, and the other border which is opposite border is the lateral border, which is slightly convex. Okay, this border, see this is the lateral border from upper pole to the lower pole. This is the lateral border, and from upper pole to the lower pole, this is the medial border, which shows an indentation or depression through which various structures are coming out. That is the medial border, and that area from where these structures are coming out is called as the hilum. Okay, it is called as the hilum. I hope that you have understood all these external features. let us come to see the structures which are coming out of the hilum or going in the hilum. Now this is the right kidney. First I will show you, and I will lift this structure which is more towards anterior surface. See this is the anterior surface, and in my finger and thumb this is the vein called as the renal vein. How can I say that it is a vein? Because if you will feel it with the finger and thumb, you will see that it is flat. Okay, it is thin. Okay, thin. Artery is not a thin structure. And then once I will see this vein, so most anteriorly lies the vein. Then you will see another structure is lying here, and this structure is branching here, and this, if you will feel it with the finger, okay, you will feel that it is an artery. So which artery it should be? It is called as renal artery. This is known as renal artery. Still posteriorly, there is one more structure present here, which is, I mean to say, sending a long muscular tube, and this long muscular tube is ureter. It is called as ureter. Okay, I will just turn this because it is present most posteriorly. So I am turning the kidney towards the posterior side. See this. I have turned the kidney and we are seeing the kidney from posterior side, and here this structure which is sending a muscular tube towards the lower pole, okay, inferiorly you can see this muscular tube which is ureter. It is dilated near the hilum, and this dilated part is called as pelvis of ureter. Pelvis of ureter. So this is pelvis of ureter, dilated part, which deep inside the kidney will open into the minor and major calyces. First major and then minor. And this is the muscular tube coming here. So these three important structures can be identified at the hilum. So if you see it from anterior surface of the right kidney, this is the vein. Okay, then comes, that is the renal vein, then comes the artery which is dividing mainly into anterior and posterior branch here, if you can see the branching pattern, anterior and posterior. So this is renal artery in the middle, and most posteriorly comes the pelvis of the ureter, which is continuous down below with the pelvis, with the ureter. So these are the three structure arranged from anterior to posterior side: vein, artery, and ureter or pelvis, and its ureter, pelvis of ureter and pelvis. Right. So these are the three structure. They are organized. Here it is very well organized. Vein is very anteriorly, artery is in the middle, and dilated pelvis part and ureter is going downward. Let us see the same thing into the left kidney. Now this is the vein, no problem. So I can feel this vein with the finger and can identify it as it is thin walled. But then I am seeing here that posterior to it at the hilum, this is the renal artery, which is dividing into many branches. At least I can see here the three branches here. See this first branch, okay, then this is a second, then this is the third branch going towards the lower pole, and then these are the many branches, and these branches here, they are at the same level in the hilum where the vein was there, but vein was anterior, of course, and then the arteries, okay, they are going into the hilum. And if I turn this artery and see another structure here in the hilum, you can see this dilated structure is the pelvis of the ureter, and this is the ureter going downward, okay, going downward. Can you see the pelvis of the ureter, dilated structure here? Okay, I will just hold this part, this thing. This is the pelvis of ureter, okay, let it focus if it is not focusing. See, this is, and this is the ureter, that is the most posterior part. But in this kidney, I could find also an artery here, and this artery is still posterior to this pelvis of ureter. This is not an abnormality. This happens because artery, that is the renal artery, comes here and it divides into many branches at the hilum. Okay, segmental branches are there, and they go to the various segment of the kidney. Okay, there is one more artery going not in the hilum but directly into the medial border, and this may be called as an aberrant artery. So there may be lot of variation in the divisions of the artery. Sometimes it may so happen that artery may be anterior and vein may be a little posterior to the artery. Okay, if I see this portion, it appears as if artery is going more anteriorly and vein is posterior. But then normal case is that vein is most anterior, then comes artery, and then comes the pelvis and the ureter. Okay, pelvis and ureter, right, which is more towards the posterior surface. The pelvis, you can see it is a good pelvis here. You can appreciate the dilatation of the pelvis and formation of the ureter. Let me clean it little. Okay, yes, if you can see here, okay, this is that the pelvis of the ureter, and this is the ureter is here, right? So these are the structure present at the hilum. Now let us come to the relations. Okay, let us come to the relation, and for the relation, okay, if we see the anterior relation, then these anterior relations are different in the right kidney and into, because it lies on to the right side of the abdominal cavity, and this lies on left. Naturally the organs, and this is the most posterior organ in the abdominal cavity, close to the posterior abdominal wall. So the organs are different for which are in relation to the right, and organs are different which are in relation to the anterior surface of the left kidney. So let us see the organ onto the right kidney. On the top of this upper pole, which is broad, there will be a relation of the, let me show it with forceps. There will be the relation of the suprarenal gland, that is the right suprarenal gland. Okay, then this area is for the hepatic. Okay, this whole area is for the hepatic. So the liver is in relation to this part, a large part below the suprarenal gland. It is in relation to that of the liver, and this part, hepatic part, okay, hepatic, I mean to say area where it is in relation to the liver, is covered by the peritoneum. Okay, it is covered by the peritoneum, okay, here. And then down below where this depression is seen here, it will be the colic area, that is the right colic flexor will lie here. Okay, it is the colic area. But here the medial border of the right kidney, here where I am just moving my forceps, is in relation to that of the duodenal area, is in relation to the duodenal. While you are just watching this video, next time keep your diagrams, keep the book open and diagram open. So while I am teaching you, just open the diagram and you will understand it better. And near the lower pole, it is the coils of jejunum may be in relation to this. Okay, it may be, and that area is also covered by the peritoneum. Okay, so hepatic area and jejunal area, they are covered by peritoneum. Quickly I will just review again the structures in relation to the anterior surface of right kidney. So this is in relation to the right suprarenal gland. Then from here to here, this is the hepatic area covered by peritoneum in relation to the right lobe of the liver. Then it is the right colic flexor is here, and this is area in relation to the jejunum, while the medial border near the hilum is in relation to the second part of the duodenum. This were the anterior relation of the right kidney. Let us come to the anterior relation of the left kidney. Again, similar to the right, your upper pole is in relation to that of the left suprarenal gland, with the left suprarenal gland, and then it will be coming an area which is the a small area is in relation to the stomach bed, that is, it is relation with the posterior surface of the stomach. This area is covered by the peritoneum. Okay, this area is covered by the peritoneum. Near the lateral border up to the middle of the kidney, this lateral border and part of the anterior surface where I am moving my forceps, this area is in relation to the spleen. Okay, the renal impression of spleen. Sorry, this is the in relation to that of the spleen. And in the center, this area is in relation to that of the pancreas. Okay, so this anterior part here in the middle, it is in relation to the pancreas, and then we come to the lower, near the lower pole, but more medially a large area here is in relation to jejunum, and this area, as I said, in the right kidney, in this also in the left kidney, is covered by peritoneum. So which were the areas covered by peritoneum? The jejunal area here near lower pole, then the splenic area, the gastric area, they are covered by the peritoneum. The lower half of the of the lateral border in this left kidney, it is in relation to the left colic flexor and the descending colon. Left colic flexor and the descending colon. So these are the relation of the left. So you see that the relations are different in anterior and posterior, on the right and the left kidney. But when we go to the posterior relation of the right and the left kidney, which are the flat surfaces, okay, the relation are same for right or the left kidney, because the structures they are present in the posterior abdominal wall, they remain the same. The uppermost part will be the diaphragmatic relation, okay, near the upper pole, it is in relation to the diaphragm. This part, upper part, it is in relation. As I said, that posterior surface is not covered by peritoneum, okay, it is in relation to that of the diaphragm. Then the medial most part near the hilum will be in relation to the muscle, psoas major muscle, okay, psoas major. Then here, just lateral to the psoas major, this flat area is in relation to the quadratus lumborum, and near the lateral border, okay, convex lateral border will be the transversus abdominis. So three muscles, they are in relation below the diaphragm. Above is the diaphragm and the arcuate ligament. It is the medial and lateral arcuate ligament from which the diaphragm is taking origin and fibers are going upward. There are three muscles here lower down, psoas major, quadratus lumborum, and laterally is the transversus abdominis. Now the nerves are also in relation to the posterior surface of the kidney, both. Okay, the relations are same, okay, relations are the same. There is a presence of the subcostal nerve, which is the 12th intercostal nerve, 12th, spinal nerve. It is the subcostal nerve. Then it is the iliohypogastric, and the last one near the lower pole, it is the ilioinguinal. So it is ilioinguinal, iliohypogastric, and the subcostal. Iliohypogastric and ilioinguinal are L1, okay, spinal segment L1 taking origin. So these are the nerves, three nerves, that is subcostal, iliohypogastric, and here is the ilioinguinal nerve. They are in relation. What are the vessels which are in relation? It is the subcostal artery and vein which is going along with the subcostal nerve which is in relation. Now since this kidney is resting onto the posterior abdominal wall, this in the diaphragm, it is in relation to the ribs, okay. The right kidney is at a lower level, so it is only in relation to the T12. It is in relation to the 12th rib. But the left kidney, since it is at a higher level, okay, it may be in relation to 11th also. 12th is always there, but it may be near upper pole, it may be in relation to the 11th rib and then the 12th rib. So these are the relation of the posterior surface of the kidney. Lastly, I will tell you, I hope you have understood the external feature. In practical exam, the examiner will definitely ask you to hold the kidney in anatomical position and determine the size. So if you want to keep the kidney, say it was the right kidney, it is the right kidney, broad upper pole, narrow lower pole, which is blunt, okay, and then see the arrangement of the structures on the hilum. Most anteriorly vein, then artery, and then the ureter, and try to see the direction, in which direction your ureter is going. It must be going towards the lower pole, okay, right. So once you have determined this, then it becomes easy to identify the side. Vein must be anteriorly, and ureter and pelvis of ureter should be most posteriorly. So this kidney is of the right side, but if I will try to keep it here, then I will see that ureter is most anteriorly, which should not be like that, okay. Ureter should be most posteriorly, vein should be most anteriorly. In addition, you can just trace your finger on anterior surface should be irregular and convex, and posterior surface should be flat. So there should not be any mistake in identification of the side of the kidney. Now comes a question about the its anatomical position. Just keep the kidney, okay, so its medial border is slightly anterior and medial. The lower pole, okay, is little laterally, and upper pole is more little towards the median plane, okay, towards the median plane. So this will be the I cannot show you from front because camera is at the top. Try to just practice in your dissection hall how to hold the kidney in anatomical position with the help of your teacher, okay. Thank you very much for watching this video on the features of the kidney, identification and its anatomical position.